Hi everyone, welcome back to Break the Stigma today. We're here with Livia Peterson and I'm excited to hear more about her story. She has an incredible one and I'm excited to share it with all of you. So Livia, if you don't mind telling us a little bit about yourself and who you are and what you do, I'll let you take it away.
Hi, everyone. I live in Milwaukee, Wisconsin. I'm a junior college student majoring in English and minoring in film studies and Jewish studies. I'm also a dedicated mental health advocate, and I love writing my mental health story as well. I'm a big writer, and it's just so rewarding to share my story to help people feel not so alone in the whole nine yards. It's very rewarding.
Yeah, we really appreciate you being a voice here and sharing your story and undoubtedly helping people out there who are listening. So thank you for being here today. So with that, I'd love to dive into your mental health journey and what that was like for you, what your relationship with mental health is. Could you share a little bit about that?
Sure thing. I was in denial for several years. I was like, oh man, I don't need help. And my parents kept on nudging me and saying, you need some psychotherapy and medication. And then I finally caved in and admitted, yes, I do need help. And this was after my primary care doctor referring me to behavioral health several times. But I started treatment amid the coronavirus pandemic. So I started out with psychotherapy. I was shy to my therapist at first, but then I warmed up to her and I opened up about my symptoms. And she's helped me gain some insight into my mental health issues and allowed me to know that seeking help is not a weakness. And then I sought treatment with my psychiatrist 5 or 6 months later, something like that. And I was also very shy again, but then I eventually opened up and I was like, okay, yes, I worry a lot and I have these obsessive thoughts and compulsive behaviors and paranoid thoughts. And I'm like, okay. So then we started off on an antidepressant, and it took me a while to find the perfect medication because the first antidepressant was made me very hyper without a bipolar diagnosis because I live with general anxiety disorder, obsessive compulsive disorder, and unspecified psychosis for the paranoid thoughts. And it was hard opening up about my symptoms to my mental health care providers, but it felt good after knowing that they can help me. So then I was on I found the perfect antidepressant, and it took a while to find the right antipsychotic, but my mentor helped me realize my antipsychotic medication was not working. So I recently switched to antipsychotic medications, and we're working towards that right now. And it's been quite a journey. I'm grateful for my mentor who helped me realize one of my medications was not working, and I'm grateful for her.
Yeah, what a journey you've been on. And it sounds like a difficult one, but it sounds like you have found a place where you're moving towards mental wellness and balance. And I'm really happy for you.
Thank you.
I was going to ask, before you had a diagnosis and before you kind of went to treatment, when your parents were pushing you a little bit, what was that like for you? What was the experience in experiencing perhaps imbalances in how your mind worked, but not quite being ready to pursue psychotherapy like your parents were suggesting?
It primarily dealt with self-stigma. I was like, oh man, I do not want to admit I have a mental health condition. I really don't. Oh man, is psychotherapy going to be really bad? Oh my gosh, I have to open up about myself to the stranger and why? And oh my goodness, this is so new to me. And I was in speech therapy when I was younger, but this is different therapy. So I was like, oh no, what is this going to entail? And I was like, okay. And then when I went to the intake appointment via telemedicine, I was like, okay, she's a nice gal. All right, I can open up more about to her. And I eventually opened up more about my symptoms with further appointments. And it was like, okay, she can really help me with my anxiety. I'm like, oh yes, now I feel so much better that I can get my anxiety under control. I'm worried less because I can share my concerns with with an objective person.
I'm so happy you had that experience. It sounds like a relief in sharing your thoughts, like you're saying, and taking that step and seeking that help. And I love the line that you said earlier, and seeking help isn't weakness. It's not weak to seek help. I can't remember your exact wording, but that's really powerful. And you definitely have personified that in your journey, and I hope inspire others to do the same. So you mentioned self-stigmatization during that while explaining your mental health journey. Have you felt stigmatized from external factors as well throughout that journey?
It depends. Like if people knew what medication combination I'm on, I always assume that they're gonna get the worst because that they're gonna think the worst. It's just I have anxiety and I have a unspecified psychosis, so I need to just manage it with this medication combo. And the self stigma came from just internally. I'm like, okay, I really should not be feeling the stigma, but mental health is. I'm not crazy.
Yeah, absolutely. Absolutely. That's so hard to overcome too. That's kind of been a theme in some of the interviews of talking, which surprised me, but talking more about that self-stigmatization than the external stigmatization, that experience that other people impose on you. Like, yeah, that other people impose on you. Which is really powerful because we can be our own biggest critics, and it's really hard to overcome that. What did you find most helpful in your journey to overcome that self-stigmatization? You mentioned therapy. Was there anything else that helped during that process?
Uh, I discussed with my therapist, like, my medications I take, and how I can just remind myself that no one really cares what medications I'm taking.
Mhm.
Uh, just unless you blurt it out, um, it's just you gotta stick up to for yourself when you want to change your medications and stuff. And with the help of my mentor, she helped me with that. And my mental health advocacy was part of my treatment plan at one point. I think it still is a little bit, and it has helped me tremendously. That sharing my story with others is very powerful.
Yeah, it is very, very powerful. And thank you for sharing it today. Um, what do you wish people would do every day to either help the general stigma around mental health or help with one's internal stigma with mental health?
Take action, whether that's reaching out to a friend, um, uh, getting involved in a mental health community,
Mhm.
and talking about your concerns to a therapist or a psychiatrist. Stand up for yourself when your treatment plan is not working, um, and yeah, you just got to stand up for yourself. And I was also introduced to the gut brain access supplements by this same mentor, and I've incorporated that into my routine, and it works beautifully with my medications. And that mentor helped me realize that it's perfectly fine to have a holistic solution and a Western medicine
Mhm.
to work together.
Absolutely. I think it's often a combination of that in helping people to the maximum effect. And it's worth exploring different modalities and different aspects of treatment. And it's so individual what works for you. I'm glad that you found what works for you. And I hope that in others hearing your story and your experiences and your ways of finding mental wellness will help guide their source of healing as well.
Yes, yes. I just try to make sure that people do not make assumptions. That's my major self stigma is people assuming what I have.
That's completely fair. I think we all make assumptions every day, and it's really hard not to. That's a really hard skill to unlearn.
Yes, yes. That's why it's just I don't want people to assume that I have bipolar and all that stuff. No offense to bipolar people. It's just uh, um, um, I just don't want people to assume. I want them to realize that you are not alone.
Mhm. Absolutely. And yeah, I mean that's a very personal thing. Your diagnosis is a very personal thing. And I don't think any of us have a right to assume what people live with and what their experiences have been and what their story is. And kind of taking that humbled position in I have my own story and you have your own story. The only way I can know is to talk to you and to learn about you as we're doing today. And so I hope people take that message away from listening to us on this podcast.
Yes,
Mhm.
yes. Sharing the story is powerful, and it's very important they feel not so alone. And reaching out to your mental health team uh, when the treatment is not working.
Mhm.
Uh,
Mhm.
you got to stand up for yourself.
Absolutely. Absolutely. That's so, so important. And thank you for sharing that. Do you have anything else to add today before we end?
Uh, find patience and be persistent. You are not alone. Um, reach out to your friends and reach out to your therapist and reach out to your psychiatrist uh, whenever symptoms are getting bad, and hopefully they'll provide some support. Uh, network with fellow mental health advocates. Uh, they can become your besties if you really establish a nice relationship with them.
Mhm. Mhm. Absolutely.
And just know that mental health advocacy is a powerful thing, and you get the leverage of how much you can share or not share with people.
Absolutely. And thank you for being an advocate today on Break the Stigma with us. And so thank you so much, Livia, for sharing your story. We all really appreciate it, and you're touching many lives.
Thank you.